it still puts people into a state of panic often because they don't know what it is and just because of the types of symptoms. So I think it would be crucial to have this type of information in sexual health education.
Hello, everyone. I'm Dr. Shafer, your host of Talks with Dr. Shafer. I'm a physician, mom, life coach, musician, author, publisher, and I am passionate about storytelling as a tool to help you reclaim your story and build your most beautiful future. And a big part of that is meeting your basic needs, and health is certainly one of the big ones. And that is why I am so excited today to have Melissa Kramer on the show. Melissa is the founder of Live UTI Free, a patient-based research and educational platform dedicated to transforming women's health. We know as women that there is a dearth of really quality research on a lot of women's health related topics. A lot of the research is actually translated from research even on men's bodies and not on women's bodies. So it is so important, especially from a patient-led perspective, to advocate for doing more research so we can make better informed decisions as patients and as clinicians. So please, thank you so much, Melissa, for being on the show. And I can't wait to share your story.
Thanks so much for having me.
Tell me, Melissa, what led you to doing this important work?
It was really my own experience with recurrent and then chronic UTI, which started around 2011, I think. And I had an experience that is very similar to so many that we hear in my community now, in that I had a single UTI and I went through the standard healthcare guidelines. I had a test, I had antibiotics. A couple of months later, I had another UTI. And every time it happened, I thought, that's okay, this time will be the last time, and then I'll be fine after that. But eventually the episodes of UTI just got closer and closer together. Doctors started telling me they didn't think they could help me anymore. At the time, I was also traveling the world. I was working full-time and traveling full-time. So I saw doctors in many countries who told me the same thing. They could give me antibiotics, but they couldn't help me with the long-term problem. And I eventually ended up in a place where my symptoms were continuous. I had symptoms of a UTI every minute of the day. And this was about 5 years after it started. So for 5 years, I'd been dealing with this problem. And it did eventually find a way forward, which was mostly through my own research. But one of the things that I discovered on that journey was that all the research online says the same thing, and it doesn't cater to those patients who do not get help by the standard guidelines. And I was meeting more and more people in similar situations. They had recurrent UTIs, doctors weren't able to offer any solutions. And I felt that through my own research and the position I was in and my background, that if I did recover, I might be able to provide a platform for other women in similar situations to find a way forward. And I did recover, but I took a year off between that and starting Live UTI Free just to live my life and to not have UTIs. Then I launched Live UTI Free. We built an education platform. We've grown a huge patient community around that. And more recently, we've been conducting our own research, all so that we can help improve patient outcomes.
That's so important, the work you're doing. I want to reflect back on that courageous decision you made to invest in yourself, regaining your health, as well as building your future, which is, again, what we are all about here on Talks with Dr. Shafer. It's such an important thing to do in one's life. When you did that, tell me, if you can, about what behaviors or things did you notice in your life that became actionable steps for you to change to get to the place of healing, to get to the place where you weren't having those symptoms every day? Because that is, if you have never had a UTI, for our listeners, it may be hard to understand, but if you have had a UTI, that is incredibly painful and disruptive. And it's just, to imagine living with that every day, that would be so limiting. So once you took your time back and you said, I'm going to figure this out for myself, and once you did that, I'm going to figure that out for others, what did that look like for you? What were the habits you noticed and the things that you made changes in?
I think the main habit was ceasing relying on clinicians to fix this problem for me, because the standard clinical guidelines were clearly not built for people in my situation. And although I had been researching the problem myself, it kind of tends to follow this pattern. And we see this in many people in the community, that you do intense research when you have symptoms, then you feel better and you stop looking at the research because you just want to get back to life. And you're hoping that this round of treatment is the thing that will fix you. And then you get symptoms again and you do research again. But for me, because the symptoms started to get closer and closer together and the antibiotics I was being given actually made me worse a lot of the time, I started to look at different things, like maybe the antibiotics I'd been using over time had caused a dysbiosis that was contributing to my UTI symptoms. And so I did get help from one clinician who was more willing to look into that side of things. Maybe it was a candida problem rather than a bacterial problem, or both, which was quite likely the case for me. And so I ended up making a lot of lifestyle changes, fairly drastic ones to my diet. I was already vegetarian, but I went on a much more strict diet, became vegan. I started eliminating processed sugar from my diet. And I just took a lot of different supplements that I'd researched might support different areas of my health. And that took over the course of about 10 months of doing this. I started to feel better until I got to the point where my symptoms had fully subsided. But I continued with the intense version of my diet for about 2 years until I really felt confident that I could go back to being a little bit less strict with myself. And I haven't had to return to such a strict diet since then, but I have had another experience of chronic UTI related to a catheter when I had surgery for endometriosis. And so I've dealt with this situation twice for different reasons and had to take totally different approaches. But the main thing that was common between those two was doing the research myself, trying to figure out what might be contributing to the underlying problem and whether there were steps that I could take, knowing that clinicians might not be able to provide the answers.
Well, it's important to note that, you are the expert in you,
Mm-hmm.
right? And there are simple UTIs that follow protocols
Mm-hmm.
and readily recover with medication. And there are those that don't. And so it's important to not fall back and just give up and cope with these chronic symptoms and how they're disrupting your life, but really investigate other modalities. Because yes, clinical medicine doesn't have all the answers for everything. You are an entire human being, and we do need to think about our nutrition, our sleep, our stress, all these things that are going to affect our body, how it's interacting with the bacteria and the
Mm-hmm.
fungi and things that honestly naturally live on our body,
Yeah.
how those get disrupted by choices we make, by infections we have, by medications we take, by our diet, by exposures. And so it's really important to take a step back like you did and kind of take the reins of your health and say, I'm going to look at this holistically and really figure out what's going on here. Because in a 15-minute appointment with a physician or a
Mm-hmm.
nurse practitioner, that might be a challenge that you're not gonna clear that hurdle. So I'm so glad to hear how you did that, and in a responsible way. It's important to tell listeners too, you should work with your doctors, you should go down these avenues, but you also should understand your body and work towards a holistic approach. There's a time and place for all of these modalities. And just make sure as you're making choices that you're making safe choices.
It does help to have support if you can find it. It's one of the reasons that we've grown a network of clinicians that live UTI free so that we can provide information about those who might be able to help patients in similar situations. But I think it's also a really big decision to make. And it's not that this time I thought the approach that I was using would be the answer. Again, I thought it wouldn't be the answer. Every time I tried something new, I hoped it would be, and then it wasn't. So I didn't know that this new approach was going to be the thing that changed it for me. And it's really hard to keep on going when everything you try fails. And so I just feel lucky that I actually found a way forward. And I speak to women every day who haven't found a way to even alleviate the symptoms at all. And I think that we need to recognize just the impact on quality of life that these kinds of conditions have and the pain that people suffer through on a daily basis.
Yes, absolutely. And I love this focus on being patient-led and researching, right? Quality
Mm-hmm.
research, but being patient-led because patients know the questions that need to be asked, right? And they may be
Yeah.
a different question than what a practitioner would ask, than what a researcher would ask. They know the question from their personal experience, and that's a great place to start to ask the right questions or the
Mm-hmm.
questions that will lead us to the answers we're truly seeking. Tell me a bit about how I know when you discuss your work
Mm-hmm.
at Live UTI Free, you often discuss patient experiences and how they're sharing that in your community. Can you tell us a little bit about that?
We deliberately set out with Live UTI Free to be patient-led. So I'm a patient myself, but I am also a PhD researcher, and our team is mostly made up of researchers, many of whom have experienced chronic illness, some of whom have experience with UTI. But it's always been really important to us to learn about the patient community, what they need. Also, not to assume that because I've been through this experience, I know what they need. Every single person's
Mm.
experience is different. So we started out by interviewing a lot of patients with this experience and then developing resources that they requested. And everything that we do now continues with that feedback loop. So if we have questions from the community that we can't answer because the research hasn't been done, the next step is usually to find an expert in the space who is working on this and implementing things practically for patients, and then to interview them. And we take questions from the community for those experts and we ask the questions. So then the patients get answers in an indirect way. And that's the way that we can kind of make sure that new research is getting into patient knowledge as soon as possible, rather than the 17 years on average it takes to actually change clinical guidelines. Patients can't wait that long. So we really want to equip them with as many tools as possible. But in doing that, we want to make sure it's what they actually are after. And so
Mm.
everything that we do is informed by patients.
That's so beautiful. And it just makes me think about life in general, right? If we actually ask someone instead of trying, okay,
Mm-hmm.
someone's going through, let's say grief, right?
Yeah.
Something has caused grief in their life. And we're thinking, okay, how am I going to fix this? And we come up with this plan and these actionable steps we're going to take to fix things. And if we just ask them what they need, it might be something completely different.
Mm-hmm.
So I love this focus on asking the questions so that you can really direct the research in a way that's going to really benefit the patients. That's so wonderful. Another thing that I know you are passionate about is the gender gap in
Mm-hmm.
pelvic health research and the consequences of that. How are you at Live UTI Free with your research working to help bridge that gap?
Everything we do, because we're in women's health and our community is around 96% female, is geared towards closing that gap. But you see the problems in the gender gap in this work all the time. So, for instance, the standard urine culture was really developed in the 1950s and has not been updated since then, despite being proven many times in many studies that it is very inaccurate. So, that is one of the reasons that patients end up in a position like I did, that they might get a negative test result, but they do have a UTI. And at that point, clinicians often don't know what to do because they don't have the data they feel they need to make a decision. So these types of things have been affecting patients forever in this space. And we're trying to work with diagnostics companies and researchers to gain a better understanding of the bladder. And in one of those ways is the urinary microbiome, which was really only discovered in 2014. We're working with the team who made that discovery on the Bladder Biome Project in the US, which aims to better understand the urinary microbiome in people who do experience recurrent to chronic UTI and compare that to people who don't, so that we can hopefully change everything about the landscape of how this illness is tested, diagnosed, and treated, because we don't really know if treatments are smart. Now that we know there's a urinary microbiome, is it smart to
Mm.
constantly give people antibiotics for UTI? We don't know.
Mm.
And it's sort of become a joke. It's not funny that there's a gender gap, but the only thing we have sometimes is humor. And our
Yeah,
favorite response is, we don't know. The research hasn't been done. And
right.
there is a whole long list of research that needs to be done, and we're trying to address one piece at a time. But the main thing that we think is missing from a lot of research is that patient perspective. If you're not including patients in research from the beginning, how do you know that you're really improving their outcomes? So we're trying to work closely with the patient community to put together patient advisory groups to make sure there's patient involvement in research with other collaborators, and just to really make sure that's the focus of the research. We want to change patients' lives. We don't just want to discover new science. And so that's always our mission. And we hope that we can help change or close that gender gap in this space, at least.
Mm. That is so compelling to start from the place of to not get kind of stuck in the weeds, because I think it's really easy as scientists,
Mm-hmm.
researchers, and patients too to kind of get stuck in the periphery. I love the focus on coming back to the most important key part that should motivate us moving forward, which is I don't know. We haven't done the
Mm-hmm.
research. What shall we do about that? Because the answer is obvious, right? Because when you get stuck in the weeds farther down the pipeline, it's easy to say, well, we could do this and that and the other thing, and where's the money and all that. But when you just take a step back and you say, hey, we don't know, we haven't done the research, that's really compelling. I think that's a really important starting off point to hopefully really propel us into the direction of doing better for women in an
Hmm.
evidence-based way.
And you mentioned the money side of things, so it is incredibly difficult to get funding in women's health. And it
Mm.
has changed over the last year or so. We've noticed more projects in the UTI space getting funded, including some of our own research. But it is very, very hard to get the funding that is needed to do this basic research when there isn't necessarily a product at the end of it that will make money. So we rely a lot on volunteers to participate in our research, and we fund a lot of research ourselves because we just know it won't get done otherwise.
That's amazing. And how can, if someone's listening, because that's one of the things I love about the human spirit, and I think also listeners of talk shows and podcasts like mine, these are helpers these are people that are inspired. They're listening to
Hmm.
this episode. If someone did want to help fund this important research, where
Hmm.
would you send them to do so?
And people can always get in touch with us by email. That's the best way. So it's
Mm-hmm.
team@liveUTIfree.com. And that's the same for patients who have questions. We answer every single email. We're really happy to share resources if we have them. And we do try to do that regionally, so it's more applicable to where that person is based. And we're always
Mm.
happy to hear from potential funders or research collaborators who would like to get connected with the patient community. And so anyone is welcome to reach out.
That's wonderful. Thank you. Because I think there is a barrier. We hear about all these amazing causes, but we don't necessarily know how to get keyed
Hmm.
into them, right? And so I think that's a really important piece. So thank you for sharing that information. And if someone is so inspired, absolutely reach out to Melissa Kramer and Live UTI Free because they're doing important work. We were talking about practical tips for
Hmm.
women before we came on air, and like you just covered with me, we don't have the research, so we can't give a one size fits all tip.
Hmm.
And on this show, we don't give medical advice. We just want to give information to patients because we know they're going to go on Google and find it,
Hmm.
or they're going to go on Facebook and find it, or TikTok and find it, and Instagram. And so it's important for them to go to really high quality sources when they're getting this information and know where those sources are. That doesn't mean that it's bad information on TikTok or on a
Hmm.
podcast or on Facebook. It could be really good information, but it's important to note that it's not direct medical advice for you. It's
Yeah.
simply information to try to help guide you on your journey. So when people are looking for this advice, do
Hmm.
you as an organization have places that you try to guide them to make sure that they are accessing quality studies, quality research-based information?
Our goal is to collate that information ourselves. So we'll
Mm-hmm.
look at the latest scientific studies. We often explain those on social media, but we have a lot of articles on our site that reference the original studies, and we always link to them. So if people would like to read the originals, they can. But that's part of the problem with being a patient. It's very hard to go through all that information online and put all the pieces together in a way that fits the picture of what you're going through. So we try to provide articles that kind of capture these experiences, what might be happening. And if that is what's happening, this could be the science behind it. And here is what we do: share stories. So we share what some people have done, always with the caveat that this is a very individual process. But we do encourage people to visit our site for that initial information, which does go quite into the science. And then if they would like to follow the links to the studies. But we're also part of a global alliance with 3 other organizations that work in this space, which is Chronic UTI Australia in Australia, the UTI Health Alliance in the US, and QTIC in the UK. And we've recently formed an alliance of the 4 organizations to help direct patients between them to work on research together. And each of those organizations provides similar resources where they explain the science, they provide information about clinicians if they have it. And so we're really trying to change the information online, because once patients get to this place where their symptoms are recurrent or chronic, the standard information you'll find on reputable sites is probably not helpful. You really have to go beyond that and dig deeper into the science and the research that is being done. So we see that as one of our roles, is to be that bridge basically between patients and new research.
Share with us the website, your website that listeners can go to and patients and people who are just curious to learn more can go to.
It's liveutifree.com, and it's the same on all our social media platforms. You can find us under Live UTI Free. And we really like to engage with patients about their experiences across all those platforms. So we're very happy for people to get in touch.
You know, for me and my purpose of education and helping people to live healthy and complete lives, I think it's really important to not just meet someone where they are now, but also to think about, okay, we're here now. We're having these issues with pelvic health for women, right? Because this hasn't been addressed yet. What are we going to do right now to help people who are having UTIs? But also, it's really important when you have this mission to be thinking, how are we going to help the up and coming generations that are going to have these same struggles? How do we decrease the likelihood that they're going to end up where we are or where we were 10 years ago? And that's something that we were discussing before we came on air about sexual education in schools. You know, is there a way that we can expose young people to information about their bodies, about their urinary tract, about, you know, potential complications around sex that occur? Because we know when young women start having sex, they are at an increased risk of having their first UTI. And they may not understand why. And again, they may go to the internet and find some maybe not so helpful or not accurate resources. They may be ashamed and they may not seek out appropriate testing or treatment because they're fearful that maybe someone will know, oh, this is why I'm getting a UTI. And none of that matters. What matters is that you get the care that you need. Nothing else matters. That you get what you need, and also that you have the education available to you to try to prevent these things from happening whenever they can. Like you said, you know, you had this really long chronic bout. You got better through difficult and challenging work, investing in yourself and your health. And then it came back and you had to do it again. It's not that you can prevent every single bout of a UTI for someone, but you really can affect positive change through education. Can you share with me any of your thoughts about, you know, sexual education and genitourinary health education for young people and how we can better serve them so that as they go through these stages of life, they're better educated?
Yeah, it's interesting. We hear from people often that say when they first experienced a UTI, they had no idea what was happening. Sometimes they thought they were dying. They definitely didn't always associate it with something that had just happened. Like often it's sex, like you mentioned, that is what brings on a person's first UTI. Some people didn't relate it to that. They'd never even heard the term urinary tract infection. And
Mm-hmm.
after that, they're also hesitant to speak to their partner about it. And so this is like a big problem. We need to be talking about things that are so common. UTI is the most common adult bacterial infection. And people get one and they don't even know what it is. You never have someone that gets a cold for the first time and is shocked and afraid they're going to die. And a UTI is much worse than that, but it still puts people into a state of panic often because they don't know what it is and just because of the types of symptoms. So I think it would be crucial to have this type of information in sexual health education. But it's disappointing to see us veering away from that type of education for young people. It's not just about sex and abstinence or birth control. It should be about your body and your anatomy and how it works. So if something goes wrong, you can recognize that, talk to a clinician about it. It should be as normal to talk to a clinician about something that is going wrong in your pelvis as it is anywhere else in your body. So we would really like to see that change so that young people know what their bodies are and what they do and where they urinate from. And so where the pain is coming from may be related to the urinary tract. And a lot of people just don't have that knowledge. And it's really, really fundamental knowledge that people should have.
Yes, it's something you do all day long, every day, right?
Yeah.
And we know something, a part of our body that we use and has certain exposures, it's going to have breakdowns. And we shouldn't be surprised when it happens. I love this focus on demystify and destigmatize. Your
Yeah,
genitourinary tract is a part of your body, just like your nose, right? It's
exactly.
just another part of your body. We're not
Yeah.
embarrassed to say, I have a nose.
No, and they all have functions, and it's,
Yes.
I mean, I guess some people are embarrassed if they have diarrhea, but if something goes wrong with your digestive tract, you go to the doctor and you say, I have diarrhea, you should be able to go to the doctor and say, I'm urinating blood, or my pee is cloudy, or it smells weird, instead of just waiting to see what happens. Because UTI can become quite serious, and it's not something that should just be left on its own to see what happens. But if you don't know that that is what could be happening, you also might wait. And that's why I think it's really important for people to better understand, why do we know that diarrhea is a bad thing, but we don't know that burning urine isn't?
Right.
Or is as well, I should say.
Right. It is. And it can be caused by multiple things. And that's why it's important to have these resources and these tools. One thing I'd like to add, as a neurologist, and I don't know how much of your community is comprised by this part of the population, but something that I would see in the emergency room frequently and in the hospital would be an elderly person coming in with a UTI, but they're having cognitive side effects, right? They're not complaining of dysuria or pain when they urinate, or a change in how much fluid intake or bleeding or anything like that. They're coming in with cognitive symptoms. And now I think emergency rooms do a really good job of getting a urinalysis at first and identifying that. But I think it's an important thing for the public to recognize that, when we have certain factors in our life, like when we've reached a certain age or we're caring for ailing parents, elderly parents, and they are having a change in their mental status and their mentation, think about the urine. Think about, are they dehydrated? Are they having changes in their urine? Is that something we can investigate? Because that can be a cause of changes in your mental status, and a really important one in this population.
Yeah, it's something that we're focusing on in our work this year, because we do hear from people in our community that might be taking care of older parents, and they might be convinced there's something going on in the urinary tract because of behavior change or what appears to be sudden onset dementia, or maybe incontinence, which is another thing that people just assume happens when you're older, but it can be caused by a UTI. And we don't really have good tools to monitor that kind of situation because they haven't been developed. But our team has developed 2 patient assessment tools for recurrent UTI in the general population. And this year we're going to be looking at whether we can create something that can be used by a proxy to better monitor older people and maybe look at different sets of symptoms. So I'm hoping that that research actually comes out with something that will help this situation. And part of that research is looking at care facilities and how UTIs are managed in those facilities as well, because there are likely some improvements that could be made if the guidelines were changed.
That's really, really exciting and meaningful research that I'm really excited to follow up on that over time. And you said something there about access, and that is just so incredibly important for UTIs. UTIs, they don't happen on our schedule, right? They have their own schedule.
Yes.
And sometimes something happens and you think, oh man, I hope I'm not going to get a UTI after that. But most of the time you don't have any warning. You can't anticipate it. And just like you have described about, being on an airplane and oh my good, or being in an airport and then having to take a flight and not having a mode to treat or investigate at that time. I think it's important to help people try to understand. So what are the things I'm going to do when I get these symptoms? If I know this is a recurring problem for me, or if I've never had a UTI and now I understand what it is and what the symptoms are, what do I do when it happens?
If it's your first UTI or you've hardly had any, you probably don't have anything with you that you can actually take. But drinking more water is always a safe option if you do have symptoms, and it can help reduce the symptoms. And sometimes UTIs can be self-limiting. So for some people, it will go away on its own, but we don't hear from a lot of people. They probably wouldn't be in our community if that was the case.
Right.
So it is important to seek medical care because you might need to get treatment for that. But a lot of people who have experienced multiple UTIs carry something with them all the time, and that could be antibiotics to take as soon as they have symptoms, or some kind of herbal remedy, or Hiprex or Dimanos. And sometimes just things to relieve symptoms. So you can take pain relief, or you can take urinary alkalinizers and things like that to take away the burning. And sometimes a cold water bottle or a hot water bottle can help. So people tend to build these kinds of routines around the symptoms, at least to try to be a bit more comfortable while they try to get to treatment that will hopefully work better.
That is so, so helpful. And I just so appreciate you sharing this information with our audience. I'm sure that there are people who have chronic UTIs who feel really seen and heard and learned something today. And I'm hopeful also that there are people who have maybe had one or no UTIs, but they'll be better just served if unfortunately this arises in their life, because they know what it is. They know to seek care, and they know to take care of themselves, that it's normal. There's no shame in it. It's just a
Yes.
part of the human condition. We have bodies and they have breakdowns, and we need to manage them.
Yes, that's a good way to put it, I think. If people can just be more prepared for if it does happen, that's the best place to start.
Exactly. Well, thank you so much, Melissa. Thank you, Melissa Kramer, for being here on Talks with Dr. Shafer. And if anyone has questions for Melissa, she told you how to reach out to them via email or on the website and how to join that community. And I think that sounds like a wonderful resource. So I encourage you to do so if it would be of benefit. Thank you so much for being here on Talks with Dr. Shafer. And as always, you can send comments and questions to me through my website, www.drshaferstajanova.com. Stay safe. Take care, and I'll talk to you soon.
Everybody's lonely, but you can hold on to me, and I will try to make it right. Everyone needs something. Let me be that